amino acids. Good morning. Welcome to medicinal biochemistry class on proteins and amino acids. So today we will learn about porphyria. So the objectives of today's class are, at the end of this class, the student shall be able to define porphyrins, explain biosynthesis of heme, recall different types of porphyria, recall symptoms of porphyria, recall complications of porphyria, and recall treatment of porphyria. So porphyrins are a group of heterocyclic macrocyclic organic compounds. So they are composed of 4 pyrrole rings. So these modified pyrrole subunits are interconnected to each other via an methane bridge. So these are the bridges. So it contains 1, 2, 3, 4 methane bridges. Methane bridges means double bond CH. It contains a double bond CH group. Okay. So the most abundant porphyrins that occur in nature are found in hemoglobin and chlorophyll. What are the functions of porphyrins? Porphyrins serve as prosthetic groups, that is non-protein part for proteins. Okay. So they are prosthetic groups of protein structure. So these are the prosthetic groups of hemoglobin and myoglobin. So they perform, hemoglobin and myoglobin perform oxygen transport functions, breakdown of peroxidase. So they are part of catalase enzyme. So they are part of cytochromes A, B, and C, which are involved in electron transport chain. So they are part of cytochrome P450, which catalyze many reactions like hydroxylation. So they are part of nitric oxide synthase enzyme. So they help in light absorption in plants. So because they are part of chlorophyll. So this is the structure of hemoglobin. So one of the important feature of this structure is all the pyrrole rings, the nitrogens that are present in the modified pyrrole rings are bonded to an iron atom. So that is chelation. Okay, so at the center of porphyrin ring, a metal atom is chelated to the nitrogen atom of the pyrrole. So that is one of the feature. In heme and related proteins, this metal atom is iron, and in chlorophyll the metal atom is magnesium. Okay, so that is the difference between chlorophyll and heme. So the biosynthesis of porphyrin, here more we will emphasize more about heme, biosynthesis of heme. So this biosynthesis of heme happens in 3 stages. So we have divided these 3 stages depending upon the location. Okay. So the first stage is in the mitochondria. So initial steps of the synthesis. The second stage happens in cytoplasm, intermediate steps of the synthesis, and the third stage again happens in mitochondria. So that is, the intermediates will be moving in and out of the mitochondria. Initially the reactions will happen in mitochondria and the intermediate will move out of the mitochondria, and some reactions happen in cytoplasm. Again the intermediate will move into the mitochondria, where the final steps of heme synthesis happen. So okay, so now we'll look into the pathway. So the biosynthesis of heme starts in mitochondria with the succinyl-CoA and glycine reacting. So it forms amino-levulinic acid by the action of amino-levulinic acid synthase. Okay, and this amino-levulinic acid is carried out of the mitochondria into the cytoplasm, and in cytoplasm further reactions will happen. So here amino-levulinic acid dehydratase will convert amino-levulinic acid into porphobilinogen. Okay, so then by the action of hydroxymethylbilane synthase, or what we call it as uroporphyrinogen 1 synthase, so this is converted into hydroxymethylbilane, or we call that as uroporphyrinogen 1. Okay, so this uroporphyrinogen 1 is converted to uroporphyrinogen 3 by the action of uroporphyrinogen 3 synthase. Okay, so further, so this uroporphyrinogen 3 undergoes decarboxylation by the action of uroporphyrinogen decarboxylase. So it will form coproporphyrinogen 3. So this coproporphyrinogen 3 is then transported into mitochondria, where it is converted to protoporphyrinogen 9. Okay, so this protoporphyrinogen 9 is converted to protoporphyrin 9. Then this protoporphyrin 9 will combine with iron by the action of ferrochelatase enzyme. So it will form heme. So heme by feedback mechanism inhibits succinyl-CoA, that is amino levulinic acid synthase enzyme. Okay, so this is the rate limiting step. The first step where amino levulinic acid is synthesized is the rate limiting step, and this is also inhibited by certain drugs like alcohol, barbiturates, and in case of lack of oxygen, in case of hypoxia also. So the heme biosynthesis is inhibited. Okay, so this is the outline pathway of biosynthesis of heme. So porphyria. So porphyrias are metabolic disorders of heme synthesis. So these are the metabolic disorders of biosynthesis of heme. This occurs due to deficiency of one or more enzymes involved in heme synthesis. So this is characterized by increased excretion of porphyrins or porphyrin precursors. So this result from a buildup of natural chemicals that produce porphyrin. So this is mainly because of certain deficiency of enzymes. So due to that, the intermediates will start building up, so and which are excreted. Okay, so porphyrins can be either inherited or acquired. So the most common form of acquired porphyrin is due to lead poisoning. So there are two general categories of porphyria. Acute mainly affects the nervous system. Cutaneous mainly affects the skin. So there are some types of porphyrias which affects both the nervous system and skin. So acute porphyria. So the buildup of porphyrin damages the nervous system. So they appear quickly and they can be severe, and symptoms may last days to weeks and usually improve slowly after the attack. So acute intermittent porphyria is common form of acute porphyria. So this is one of the examples of acute porphyria. So symptoms of acute porphyria include severe abdominal pain, pain in the chest, legs or back, constipation or diarrhea, nausea and vomiting, muscle pain, tingling, numbness, weakness or paralysis, red or brown urine, mental changes, anxiety, confusion, hallucination, disorientation or paranoia, breathing problems, urination problems, rapid or irregular heartbeats, what we call it as palpitations, and high blood pressure. And ultimately it can also cause seizures. So cutaneous porphyria, the porphyrins build up in the skin. So when exposed to sunlight, it causes symptoms, causes skin sensitivity to sunlight. So they don't usually affect nervous system. So Porphyria cutanea tarda is the most common type of these cutaneous porphyrias. So symptoms include sensitivity to sun. Sometimes artificial light can also cause burning pain, sudden painful redness and swelling, blisters on exposed skin, usually the hands, arms and face. So the skin will become very fragile with changes in the skin color due to pigmentation. So it will cause itching. So there might be an excessive hair growth in affected areas. So red or brown urine is observed. Acquired porphyria. So Porphyria cutanea tarda is an example of acquired porphyria. It can also be inherited. The enzyme deficiency may also be inherited. So certain triggers that impact enzyme production too much, like that is certain triggers that impact enzyme production or too much iron in the body, liver disease, estrogen, medications, smoking or excessive alcohol use can cause this Porphyria cutanea tarda. Okay. So these are different types of porphyrias, acute intermittent porphyria. So this is caused due to the deficiency of uroporphyrinogen 1 synthase enzyme. So this causes neuropsychiatric symptoms and abdominal pain. So this and congenital erythropoietic porphyria. So this is caused by uroporphyrinogen 3 co-synthase deficiency. This will cause photosensitivity. Porphyria cutanea tarda. So this is because of uroporphyrinogen decarboxylase enzyme deficiency. Again, this will cause photosensitivity. Heredity coproporphyria. So coproporphyrinogen oxidase enzyme deficiency. This will cause photosensitivity, abdominal pain, and neuropsychotic disorders. So variegata porphyria. So this will is because of protoporphyrinogen oxidase enzyme deficiency. So this will cause photosensitivity, abdominal pain, and neuropsychiatric disorders. Protoporphyria, acute and cutaneous porphyria. So this is because of enzyme phyllochellatase enzyme deficiency. This will cause photosensitivity, abdominal pain, and neuropsychiatric disorders. Lead poisoning. So this is an example of acute, that is acquired porphyria, inhibition of alanine dehydratase enzyme and ferrochellatase enzyme. This will cause nervous system and blood disorders. So here if you look at this, so acute intermittent porphyria is an example of acute porphyria. Congenital erythropoietic porphyria is an example of purely cutaneous porphyria, and the rest are cutaneous, both cutaneous and acute porphyria. That is porphyria cutanea tarda is an cutaneous porphyria, yes, and hereditary coproporphyria is acute and cutaneous both. Variegate porphyria is acute and cutaneous both. Protoporphyria is acute and cutaneous both, and lead poisoning is acquired porphyria. Okay, so what are the complications of porphyria? So the possible complication depends upon the form of porphyria. Acute porphyria can be life-threatening if an attack is not treated promptly. So during an attack, patient may experience dehydration, breathing problems, seizures, and high blood pressure. Episodes often require hospitalization for treatment. So long-term complications with a recurrent acute attack may include chronic pain, chronic kidney failure, and liver damage. Okay, cutaneous porphyria can result in permanent skin damage. The skin blister can become infected. So when skin heals after cutaneous porphyria, it may have an abnormal appearance and coloring, and the skin becomes fragile, and it also leaves scars. So treatment include that is porphyria cannot be cured, it can only be maintained. So certain lifestyle changes to avoid the triggering symptoms will help to manage it very well. Treatment for symptoms depend upon the type of porphyria, so only symptomatic treatment is available, and lifestyle management. So summary. So this is the biosynthetic pathway of heme. So heme is also one of the porphyrin. It contains porphyrin ring. So succinyl-CoA and glycine are the starting compounds. The first reaction happens in mitochondria. So amino, it is converted to amino levulinic acid, and then it is converted to porphobilinogen, then to uroporphyrinogen 1, then to uroporphyrinogen 3, then to coproporphyrinogen 3, then to protoporphyrinogen 9, which enters mitochondria. Then in mitochondria, protoporphyrinogen 9 is converted to protoporphyrin 9, which is converted to heme. So the enzymes catalyzing these reactions. So when there is a deficiency of these enzymes, so what happens is, so this causes the buildup of these intermediates in the blood, so which leads to various diseases, what we call it as porphyria, a group of diseases, what we call it as porphyria. Okay, so this can be inherited or acquired. So they can be, so they are acute or cutaneous, and sometimes they can be both. So acute affects nervous system, and cutaneous porphyria affects skin. So here are the list that we discussed now. Acute intermittent porphyria is an example of acute porphyria, congenital erythropoietic porphyria, and porphyria cutanea tarda are cutaneous porphyrias. Hereditary coproporphyria, variegate porphyria, protoporphyria are both acute and cutaneous porphyria, and lead poisoning is an example of acquired porphyria. Okay, so these are the references.